Good morning, everyone. We'll just a few people are joining, so we'll just wait a second and then we'll get started. Okay. Well, good morning. Thank you so much for joining us today. We're really delighted to be hosting this webinar on behalf of the ReThink Research Programme. And I'm just going to introduce myself and a little bit about Become before I hand over to Lisa to kick us off. So at Become, we're the national charity for children in care and young care leavers. And really everything we do starts with young people's voices. So through our care advice service, we offer guidance and support for young people and the adults supporting them. And our Propel programs help young people to move into education, apprenticeships, work. And our link-ups offer a space for young people to come together to find community and connections. We also support professionals to build the skills and confidence to make a difference through our training offer, and that includes our accredited personal advisor development programme. And alongside that, we campaign with young people to change the system so that it works better for them. And really at the heart of it all is a very simple belief. Young people are the experts in their own lives. And as you'll hear, that's been really central to the ReThink Research Programme as well. So without further ado, I'll hand over to Lisa to get us started.
Thanks very much, Claire. So I'm just going to share my slides with you. Okay, so I'm hoping that everybody can see the slides clearly. So I'm Professor Lisa Holmes, and I'm joined this morning by my co-principal investigator of the ReThink programme, Professor Rachel Hiller. Before I get started on the presentation slides, I did just want to thank you all for coming and just to highlight that there have been a couple of technical issues this morning with numbers registering and some people having to re-register. So I did just want to highlight that if you are having difficulties or your colleagues are having difficulties, please bear with us and you should be able to join us shortly. So moving on to the presentation this morning, I'm going to start by introducing the ReThink programme, and then I'm going to hand over to Rachel to talk about the mental health and well-being of young people, and then we're going to come back round to myself to wrap up the presentation to focus on transitions out of care. We're also really pleased to be joined by colleagues this morning who will introduce later on in the session for our panel discussion. There will be plenty of time for discussion at the end of our presentation. Just one further note, you will see in the function of Teams this morning that there is a Q&A option. What we would ask is for any questions for Rachel and I or for the wider panel, please can you pop these in the Q&A and we will pick them up at the end of the webinar. If we are inundated with questions and there are some points that we don't manage to get through, we are also happy to send some further responses as part of the follow-up materials. So in terms of getting going this morning and introducing you to the ReThink programme, so this is a programme of research that Rachel and I have been leading since late 2021, and we're just now in the final stages. Over the course of the project, we have worked with 13 local authorities and adoption agencies across England and Wales. As Claire has already indicated throughout the whole programme, we have been focusing on co-developing the research with care experienced young people and have been very fortunate to be supported by colleagues at Quorum Voice and Adoption UK in that work. ReThink has also included a longitudinal analysis of the administrative data to understand the care trajectories of around about 5,000 care experienced young people across England. In terms of our primary research, we have worked with 450 care experienced young people, most of whom were children in care, to try to understand the drivers of mental health and well-being. For this group, with our primary research, they completed baseline questionnaires and then a 12-month follow-up. Of that group, most of them, so 90%, had experienced maltreatment, and many of them were struggling with their mental health. We're going to go through this in more detail this morning. And then from that 450 care experienced young people, we also conducted interviews with 53 of them, and where appropriate and possible, also their caregiver or trusted adult to explore transitions. Again, we're going to focus on this morning. So in terms of starting the presentation and really starting to share our learning and our findings with you, we're going to start with, sorry, my presentation has just frozen. Okay, it's working. So I'm going to start with our secondary analysis of the administrative data. So as I say, this was us looking at the administrative data for close to 5,000 children and young people in care. And what we have done with this secondary analysis is to focus on the care trajectories from birth to age 18. All of the children included in this sample and this analysis were in care during school year 5. So it's quite different to a lot of the other analyses of administrative data that we have seen published for children in care. We don't include those children who were in care as infants and were then adopted. And we also don't include adolescent entrants. We really are looking at that period of middle childhood. What you'll see from the graph here on screen is that we identified a care trajectory where one group of the children in our analysis experienced early stability in kinship care. With our 8 different care trajectories, we essentially identified different groupings according to stability and instability, and also different types of placements. Just to give you a sense of the children who were included in this analysis, around 60% of the children had statements of special educational needs of disabilities by the time they moved from primary to secondary school. One of the other things to say of this sample of nearly 5,000 children, almost 3/4 of them remained in care beyond the age of 16. So many of these young people made that transition out of care, 16, 17, 18. So some of the other things just to say with our trajectories and our longitudinal analysis of care trajectories, you'll see here we also had some of the young people who experienced instability, and some of those in particular experiencing instability throughout adolescence. What we've also identified when we've looked at outcomes in early adulthood is that those who experienced early stability in kinship care, that this was associated with fewer mental health difficulties and better academic attainment. However, some of the children who were experiencing instability still achieved their expected Key Stage 2 attainment. And this is something that we're going to come back to towards the end of the presentation this morning in terms of bringing all of our different work packages and different elements of the research together. So one of the other things I just wanted to highlight, again, just thinking about educational attainment, is around half of the children in this sample achieved level 1 education attainment at Key Stage 4. So for those of you that are not familiar, level 1 is the nationally mandated level of education that we would we look at for all children transitioning out of secondary school, but only 1/3 of them achieved level 2, which is those higher GCSE grades. Also, for the young people where we were looking at what was happening to them post 18, is around 1/4 of them experienced a period of not being in employment, education and training. So this analysis provides us with an understanding of the different trajectories through care. But obviously, as part of ReThink, we were also doing the primary data collection to ensure that we were able to understand more about mental health and well-being of the children in our sample. Today, we're going to focus on the older age group. So of those 450 children that I spoke about earlier, 162 of them were the older adolescents who were aged 16 or 17 at baseline, or 17 and 18 at follow-up. This is the group that we're going to focus on today, and I'm going to hand over to Rachel in a moment to talk about this work in more detail. So just going to highlight here in terms of where the young people were. So just over half were living in foster care at the point at which they were recruited into the ReThink project. Again, similarly to the first work package where I was looking and talking about our secondary analysis of the data, so around about 20% were not in education, employment or training at baseline. So I'm going to hand over to Rachel now to talk more about young people and their mental health and well-being.
Thank you so much, Lisa. So for my section today, before Lisa wraps up our presentation and then we go into the panel, I wanted to deep dive into what ReThink found in terms of the mental health and well-being of the young people in our study. Obviously, today we are particularly focusing on the 16 and 17-year-olds and looking at how things are going for them as they move into the care leaver period. Some of you would have been at our webinar a few months ago where we focused in on the school transition and our 10 to 14-year-olds, and I will refer back to them a bit today, but today we really wanted to get into what's going on over the care leaver period and what we can do differently to support these young people. Again, just to follow from what Lisa said, I can see on LinkedIn and on my email that people have struggled a bit to get into the webinar this morning. We're very sorry about that. We can see people are coming in, and just as a reminder, the webinar is being recorded, so everyone that has registered will receive a recording as well. So what did we find in terms of the mental health of our young people? Firstly, and perhaps not surprisingly for those that work with older teens in care and with care leavers, but still a statistic that we should not be happy with and feel quite alarmed about. We did find that almost 75% of our sample scored in the clinical range on a standardised mental health screening tool. We particularly found very high rates of post-traumatic stress symptoms or trauma-related distress in our 16 and 17-year-olds. So what we mean by standardised mental health measures are measures that looked at things like post-traumatic stress symptoms, depression, anxiety, as well as general internalising and externalising. And you can see, as I've said, very, very high rates across the board. We found also very high rates of poor well-being. So we didn't just look at specific mental health difficulties, but we also looked at their general well-being, hope they had for the future, how they felt about their life. And you can see down the bottom there that almost half of our sample of 16 and 17-year-olds rated their well-being as very poor. Now, that is particularly also alarming because the measure we use, these are standardised measures that have been used with thousands, probably tens of thousands of children all across the world, but particularly in the UK, including with children and teens in the care system and care experienced young people. When we look at a general population of teenagers on the wellbeing scale, we tend to find that about 15%, rate their wellbeing as very poor. And in our sample of older teens in care, we see that that is much, much higher. So 43%, almost half of the young people are saying their wellbeing is very poor. Thanks, Lisa. I'll go to the next slide. And this particularly plays out, so our wonderful postdoc that we had on this study, Beth and Carter, so we should say that the lead postdocs on this study, Beth and Carter and Eva Sprecher, did a huge amount of work with the research assistants and our co-investigators, including Catherine Shelton over at Cardiff University. A huge amount of work to recruit young people in and work with local authorities and maintain the sample, and we hope make it a positive and meaningful experience for our young people and carers. But a paper that Beth and Carter led, which is published, and after the webinar you'll receive a summary of it, looked at what we mean by the overlap of mental health and wellbeing in our care experienced young people. Partly because what we see a lot of in mental health service, or in what we call mental health services, is that often at the moment they're being rebranded as emotional wellbeing services rather than mental health services. And we wanted to know what that meant in terms of the data. And what we see here in the ReThink study is that certainly mental health and wellbeing overlap, but they're not the same thing. When we looked at this in our 10 to 14-year-olds, our younger sample, we found that quite a few of the young people that were struggling with their mental health, up to 50% of young people that were really struggling with their mental health, still had pretty good well-being. So there were some things in their life that were okay for them. They got along well with their carer, they liked school, they had hope for their future. They were still struggling, but there were other things going on in their lives that they saw as positive. When we skip ahead to our 16 and 17-year-olds, though, the story really changes there. So what you can see on this slide is that if a 16 and 17-year-old said that they were struggling with their mental health, almost all of them rated their well-being as very poor. And this really speaks to the need, a message that we'll come back to again and again, for us to be really mindful of providing earlier intervention for the mental health needs of our young people in care and our care experienced young people more broadly. Because when they're getting to 16 and 17, right before they're about to age out of the care system, a lot of them are really, really struggling, and it's having major consequences for a lot of different aspects of their lives. Thanks, Lisa. I wanted to just also deep dive a little bit into what we found around mental health, and particularly trauma-related distress. So I talked earlier that we found very high rates of high post-traumatic stress symptoms. That doesn't mean they all had post-traumatic stress disorder, but certainly very high rates of trauma-related distress was being reported. And I just wanted to deep dive into this a little bit to provide, to make sure we're really holding in mind what this is like for a young person in care or a care experienced young person. So you can see that we found that just over 50% of our young people said they sometimes or often had intrusive memories about their trauma experiences. And what an intrusive memory is, it means that pictures are coming into their mind, flooding into their mind, that makes them feel like they are back in the trauma, like they are still very unsafe. 60%, or just over 60%, said they have strong waves of feelings about what happened to them. So many of our young people in care are having to go through life with very difficult trauma-related symptoms that will make them feel like they are still genuinely very unsafe. And then linked to that, what we saw was very high rates of young people reporting that they didn't really know how to cope with this. So 70% said they tried not to think about what happened to them. And just under that percentage said they tried not to talk about what happened to them. Now, it is totally understandable that a young person might not want to go around talking about what happened to them, might not want to think about it. The challenge with that, though, is that it is very well established that avoiding talking about what happened, avoiding thinking about what happened, is related to worse mental health outcomes when it comes to trauma-related distress. But I think holding this snapshot in mind is really important when we're thinking about the day-to-day experiences of our young people. Thank you, Lisa. So moving away from what we found in terms of mental health, which is high rates of mental health, much poorer well-being than we would like to see, and particularly high rates of trauma-related distress. What ReThink was really interested in doing was moving past only describing problems. We've known for quite a long time that young people in care have very high rates of mental health needs. We really wanted to move to a place where we were developing research that shows why this might be and therefore what we can do about it. So in the next section, I'm going to talk about what we found in terms of drivers of mental health and wellbeing. So this slide just gives an overview of some general drivers of mental health and wellbeing. Firstly, when we looked at the whole sample, so the 10 to 17-year-olds, being older was associated with poorer mental health, and being a girl was associated with poorer self-reported mental health. Now, that correlation is very, very small. So it's not necessarily surprising that older young people report poorer mental health. That would be developmentally quite typical. Also that girls tend to report poorer internalising difficulties in particular, but a very small correlation. Boys still reporting high mental health needs, younger children were still reporting high mental health needs. Similarly, we also did find in the older sample that young people in non-family style placements had poorer mental health. So those in semi-independent living, residential care, etc., compared to those in kinship or foster placements, did report poorer mental health. This is relatively well established, and I think Lisa and I always want to be very clear with this finding that this isn't saying the placement causes the mental health, or although of course we know some young people have terrible experiences in these types of placements. But what we see is that young people ending up in these semi-independent or residential placements have often been through many, many other placements before they get there. So it is a relatively nuanced association, and one that's worth us holding some nuance about rather than being too black and white about it. And I know Lisa could talk about that a lot. So if there's any questions in the Q&A, we can address that then. We also found associations between placement instability and mental health. So if young people had more placements, they reported poorer mental health and poorer well-being. That is pretty well established. We also managed in our data to look at what linked those associations. And what we found was that this association was fully mediated by perceived social support. So what that means is when young people have more placements, they feel less supported, and that has major implications for their mental health, which I think, completely makes sense. I hope makes sense for people on the call as well. Overall, we found also that lower perceived social support was associated with poorer mental health and well-being, as well as emotion dysregulation and maladaptive appraisals. Maladaptive appraisals are things like, what happened was my fault, I'll never get over what happened, the world isn't safe for me, I can't trust anyone, as well as lower agency. So this is young people's sense that they have control over their lives. I'll go to the next slide to kind of wrap this all together. So in terms of what this means, what you could see on that previous slide when you look at the strengths of the associations, and what we have now seen in multiple longitudinal studies with this population, is that it's really the psychological processes that are the strongest drivers of mental health and well-being. So there are other things that are important. Lots of placement changes are not good for mental health. Poor quality relationships are not good for mental health. These things are all really true as well. But the psychological processes, how they think about themselves, how they think about the world, emotion regulation, agency, these are by quite a long way the strongest drivers of mental health and well-being, including trauma-related distress, including anxiety, depression, across the board. They're what we would call transdiagnostic drivers. So what that means, taking a step back, is that what ReThink has really shown is that whilst the circumstances around being a young person in care is unique and it can be complicated, and we can never forget the context around what is going on for the young people, when we're looking at the psychological drivers of mental health, we replicate what has been found more broadly in the child trauma and child mental health field. So these processes that are being shown to drive mental health in our teens in care and care leavers are also what we see drives mental health and well-being in broader populations of young people. And in some ways that is good news, because we already have treatment approaches and support options that target these sorts of processes. Thanks, Lisa. So again, I just wanted to deep dive a little bit more into what the data showed, what young, and when we say data, this is what young people are telling us life is like for them. So when we looked at maladaptive appraisals, as I said, this is how young people think about themselves and think about the world around them. We found that half of our 16 and 17-year-olds endorsed that they agreed or strongly agreed that anyone could hurt them. Half also agreed or strongly agreed that they have to watch out for danger all the time. So these are young people going through life having to be incredibly hypervigilant to what is going on around them. Again, a similar proportion agreed or strongly agreed that they can't cope when things get hard for them. And a third agreed or strongly agreed that they felt very scared that they'd get angry and break something or hurt someone. So again, the reason we try to deep dive into this is to really center our thinking in what it is like day to day for these young people that are going through life with a very strong belief, sometimes very understandable, that the world is not safe for them, and to the level that they feel scared about their own ability to cope and their own ability to manage their emotions. Thanks, Lisa. And then this links into emotion dysregulation, which was another very strong driver of mental health in the ReThink project. And here we found that half of our 16 and 17-year-olds, and then when we followed them up at 18, reported that they had difficulty making sense of their feelings, that they had no idea about their feelings, and that they were confused about their feelings. And then 40% endorsed that they had no way to cope with their feelings. They felt like there was nothing they could do to make themselves feel better. 70% endorsed that when they were upset, they had a lot of difficulty getting things done. So again, here, I hope we're painting this picture of what I would actually call, when we're thinking about support options, low-hanging fruits, that we have got large proportions of our 16 and 17-year-olds and our 18-year-old care leavers who are going through day to day really saying, I don't understand what is going on with my emotions. I don't know how to cope with this. I don't know what's going on. I feel really confused by this. And that is something we should know how to support them with. Thanks, Lisa. So to summarise so far, before I hand back to Lisa to talk about the qualitative work and wrap this up before our panel, older teens in care have very high rates of mental health needs, particularly trauma-related distress, and this absolutely gets carried into the care leaver period. We saw no substantial changes in mental health over this period. So if they're struggling before, they are struggling after. Many of them on an individual level were doing a bit worse, I would say. We found that well-being was often very poor, and well-being was much lower in our older sample than our younger sample. So this is something that really is declining over time and speaks to the need for early intervention. We also found that drivers of mental health are very similar to what we see in other young people, although the context is unique, of course. Psychological processes are much stronger drivers of mental health than other factors, including maltreatment history. So we replicated in this what we found in other studies, and that is for children in care and teens in care, their maltreatment history, the objective severity of their maltreatment is not the strongest driver of their mental health. It's really about the psychological processes. Overall, we also found very high endorsement in beliefs that the world can't be trusted, it's unsafe, and confusion about emotions and coping, and that this is really shaped by the unique context of leaving care and moving towards independence, and Lisa will speak to this more in the qualitative findings. And we also always like to flag when we're talking about mental health that we need to be wary if you are working in this area, whether that's in the mental health sector, education, or social care or elsewhere, that young people in care are often experiencing diagnostic overshadowing, where there's often beliefs that they don't meet criteria for diagnoses, even though there's decades of evidence to the contrary. So we just really want to be careful when we're thinking about mental health, that we are thinking about it as objectively as possible and thinking about what we can do to support young people in the here and now. And with that, I'll pass over to Lisa.
Yeah, thanks, Rachel. So far this morning, you've heard about the secondary analysis of the administrative data, and then Rachel has talked us through the findings from our use of standardised measures focusing on mental health and well-being. So the final section of the webinar this morning and our presentation is really going to focus on what the older adolescents who were involved in the ReThink programme tell us about what's helped and doesn't help during the leaving care transition period. So what we really wanted to highlight first off was that for many of the young people involved in ReThink, and again, this will not come as a surprise to many of you working in the field, is that it was overwhelming and uncertain for many of the care leavers and the young people involved in the ReThink programme. And in particular, they felt unprepared. Now, obviously, this isn't all young people, and we have included a quote on this slide to highlight that one of the young people described feeling well prepared for the transition, talking about how everything had been taken care of by their social worker. But for others, and many of the others involved in the research, that transition was abrupt and unsupported. Again, just highlighted in this quote here, where a young person told the researchers about how they were felt that they had just been thrown out of the door. They had been told the bare minimum of what to do and just to hope for the best. So obviously these messages resonate with a lot of the existing research around care experienced young people and transitions out of care. But as part of ReThink, we wanted to understand and to look at not just about how leaving care affected young people's mental health, but why. And what I'm going to talk you through this morning in this final section is to really look at the role of relationships, support systems, and picking up on some of what Rachel has already talked about in terms of young people's sense of agency and how they are feeling. So so I just wanted to start here with thinking about the formal systems around care experienced young people and in that transition period. I'm really highlighting the importance of consistency and accurate information sharing. Again, a lot of the young people involved in the research were highlighting how they were receiving inconsistent communications and messaging, sometimes between social workers and personal advisors, or sometimes between those professionals and their foster carers or key workers. So again, it's not just about the importance of the resources and those different people working with care experienced young people during the transition, but it's about the consistency of communication and accurate information sharing, making sure that all of the people who are working to support care experienced young people as they make the transition are aligned in terms of all coming together and holding what is happening for the young people. Again, some quotes here in terms of the support that might well have been there throughout those ages of 16, 17, 18. And then as highlighted by this young person, once I turn 18, it's all gone like poof. And then you are suddenly on your own, like you don't have your social worker anymore, and you're meant to meet your PA. And I think at like 16, so you can build a relationship, but they're doing it now on when your birthday is. And we really want to highlight this quote as well as the other one on screen, because it also highlights not only in terms of the support that is required for young people to make those transitions out of the care system, but also this disconnect between policy and practice. So we know that young people should be introduced to their personal advisor, that they should have a personal advisor allocated. But again, the difference between what should happen and how this is experienced by young people is really, really pivotal as we think about children's social care and the systems that support young people. So whilst we also talk about formal networks and the professionals around young people, one of the other key themes that came through from our qualitative research was the importance of informal social networks and relational stability. Now, we're not going to dwell on this today, but certainly this is one thing that Rachel and I get particularly passionate about, is the way in which, when we're talking about stability within children's social care, and particularly stability for children in care and care leavers, we focus very much on a singular measure of stability, is whether a placement was stable or not, whether the young person remains living in the same household. But actually what we were really highlighting through the ReThink research as well was the importance of relational stability, and actually recognizing that relationships, when the system as such works well, those relationships can transcend placements. Again, thinking about the different people that are in the lives of care experienced young people, as highlighted by these quotes on screen. So again, I'm hoping that my relationships, like my family and friends and everyone, maintains. And I think I'm a bit scared of drifting away when these people have been like my people for such a long time. So I think that's kind of scary. I don't want to feel abandoned. Again, it's really highlighting the importance of those informal social networks, but equally the role of the formal to support the informal as well. So it's this complex interplay of thinking about everybody working together to make sure that young people transitioning out of care have that network around them. We also just wanted to pick up again, so as Rachel has talked about, through our standardized measures of mental health and well-being, we understand more about what young people were telling us about emotional regulation, how they were viewing themselves and the world around them. Again, coming through as a theme in our qualitative research was about young people's sense of agency and about coping. Again, just highlighting here with our quotes that are on screen, was about the decisions that were being made to young people, about young people. So again, it's about the consistent messaging for them, but their involvement in the decisions that were being made about them. Again, just highlighted here from a young person involved in the research. I didn't have a say in it, but they made the decision to put me in supported living. I said to them originally that I didn't want to go to them, but they didn't provide me with an alternative. Again, really highlighting the importance of young people and their sense of agency. And as Rachel has already highlighted, the degree to which they are able to trust the world around them is impacted on their involvement in decision making and how involved they have felt as part of the decisions that are being made about them. Okay, so for the final few minutes of our presentation and before we go across to our panel, I'm just going to sort of bring it all together across the different work packages and really think about summarising some of our key learning from ReThink. So as we've worked through the findings and we've been doing the analysis with the wider team that Rachel has already mentioned, we really want to highlight this as sort of one of our headlines as such. It's never too early. That's something that all of you, many of you will be familiar with. We have talked for many years across children's social care more broadly about the importance of early intervention. Absolutely, it's never too early. But we really also want to highlight as part of ReThink that it's also never too late. So really thinking about for those young people who are experiencing care during their adolescent period, during their teenage years, and making that transition out of care, it is never too late. Those support systems can come together, and it is really important that they do so. Again, just exacerbated and highlighted here by a quote from a young person where I've moved back in with my foster carers because I was living in uni, in like the uni halls for a while, but then I kind of ended up in hospital, and then the uni kind of pushed me to come home until my mental health is a lot better. And what we often see within children's social care is quite rigid systems and decision making around what is happening for young people. And what this quote highlights was that flexibility of those foster carers, that this was a young person who had gone off to university, who experienced a mental health crisis and was able to go back to their foster carers. Again, just highlighting in the quote here that they're actually talking about coming home to their foster carers to help them through the process and through that crisis. So again, really would like you to hold in mind this thinking as you take it on from the webinar is that it is never too late and that we really need to think about putting those support systems in place. I think we would always emphasise the importance of early intervention, but equally it shouldn't be that we forget about sort of coming in later as well. We also just want to highlight that care experienced young people can access and should be able to access evidence-informed mental health and well-being at any stage. Again, really trying to think about what services and support can be put in place before reaching crisis point. Okay, so again, just wrapping up, and this is a lot of the points that we have already highlighted. We know that the mental health and well-being, there are a lot of similarities between care experienced young people and the wider population of adolescents who are also experiencing difficulties with their mental health. But there are contextual factors that are unique contributors for care experienced young people, and in particular for care experienced young people where they're having to have this very quick transition into adulthood and thinking about the role of other agencies, for example, around housing and that support that is there for young people. The importance of transitions being well planned, with the young person centred and heard, as I highlighted through that quote from a young person, is the importance of young people being part of the decisions that are being made about them, that their voices are being centred and heard. The importance of relational stability and continuity of care, recognising that sometimes within our system, and again, this is not new, it was highlighted in the care inquiry in 2013, is sometimes the rigidity of our system ends up breaking relationships. And we really need to think about what is it that we can be doing in practice to support relational stability, continuity of care, decision-making and support, that communication between and with the young person. And so just to finish up with our take-home messages, is we really need to think about that care experienced young people are young people first. As I've already just mentioned, their needs are the same as other young people, but they are navigating the transition to adulthood with unique and stressful circumstances, often without the necessary support. Again, trusted, consistent relationships are absolutely central to well-being. Making sure that young people are meeting their personal advisors earlier and are supported to maintain those relationships across the transition period. Again, this is not just about children's social care, it's about all of the agencies working together. Children's social care with education, housing and mental health services should be providing clear information and coordinated support. And finally, mental health matters. And as Rachel has already highlighted, and this is quite a difficult finding for us to hold and to understand, is that many of the young people believe that adults cannot be trusted or that the world is unsafe and may struggle with managing their emotions. So it's really important that we take this learning and think about how we best support young people with these difficulties during the transition out of care. So we are going to open up to panel. You've heard from Rachel and I, and we just wanted on our last slide to highlight for those of you, I am sure there are many of you online this morning that will be familiar with these two books. If you are not, then we would encourage you to take a look, because it really does help you to understand and to have other perspectives by the care experienced community around their experiences and taking that learning into practice. So thank you, and I'm going to stop sharing now.
Thanks so much, Lisa. So we're now going to move for the last 45 minutes to the panel discussion. I can see some questions coming in, so please do put questions in the chat. The more questions that are there, the better for the panel. But I'm going to start us off by introducing who we've got on our panel today, and then I've got a question for each of them before we go to the Q&A. So everyone listening has a few minutes to warm up with what questions they might have. Either specific to what Lisa and I have presented, or also more general questions you might have about supporting young people over and through the care leaver period. So we're really delighted to be joined by our panel today. We have Dionne Thomas, who's Director of Safeguarding and Social Care at Haringey and a care experience leader. We then have Dyllan Watkins, who's an advice and support officer at Become and a care experienced advocate. And we also have Katy Hudson, who is head of training at Become and doing some brilliant work around supporting PAs, who are obviously really central to the moving towards the care leaver period. So Dionne, I'm going to come to you first, if that's okay. And Dionne, you obviously are at the kind of working at the coalface of a service really trying to innovate and find ways to support our older teens in care and care leavers. But I think many of us on the call will recognise that there's many challenges at the moment across all different sectors. So Dionne, I wondered if you could speak to what you see as some of the major challenges that services face when they're trying to build better mental health support over the care leaver period. And also if you have any examples of innovative practice in this space, we'd love to hear about them.
Thanks, Rachel. And it's really great to be here today. And I think as you've introduced me, yes, I'm a care experience leader. So as I was listening to the presentation, it's hard not to be in the space of both a person who has that experience of having been in care and that transition. Now, some will note that I'm not that young anymore, so I've obviously moved through my life, and I'm now leading services, and it's a privileged position to be in. But as you went through the presentation, it is a subject that's really close to my heart, and it's so hard hitting listening to the findings. And it is hard that we are challenged as professionals to do better. Talking about mental health and being a care experienced is not something I tend to do very often. And partly I think that's there's still a sense of wanting to remove the stigma before you can feel comfortable in having those conversations. And so, you know, from my own perspective, the bit that you talked about it's never too late, I think is a really, really important point, just as it's never too early to start. So I think, you know, thinking about the issues, we know that for young people as they're getting older and getting ready to leave care, transitioning to adulthood, it feels like a cliff edge, that we know that there can be gaps in mental health support that you face more as young adults, even though there are challenges that we know young people face as young people living in care. I think it's highlighted even further that there are experiences of isolation, loneliness, unresolved trauma. All of those things are coming back for young people when they are post 18. And also, I think that we have leaving care staff as one example, who are often trying to support young people, but without the access themselves to clinical input to help them and support them in the work that they're doing. And so I was talking to staff in the lead up to today, and there's a strong consensus about the need for trauma-informed, flexible, relational approaches, that kind of sense that you just keep being there for young people. You keep services open and accessible, because people will need to be able to dip in and out as need develops over the years. And we shouldn't take a one-size-fits-all approach, that we really need to think in this work about how we support the wider network. That includes foster carers, families, staff, and that we do this alongside practical wellbeing interventions. So thinking about things that we can do with young people in groups that support wellbeing, thinking about things like sleep routines, social media use, life skills, but how that can help, also working alongside offers that support improving mental health outcomes. So thinking about some of the things that we've thought about that have worked, and we've been involved in the ReThink project, and I think that's probably in Haringey really got us thinking about what we want to offer. So we now are setting up MDT teams alongside both. We've got an integrated looked after children's mental health team that's just being developed, and staff are onboarding as we speak. But we've also developed alongside our Steps to Adulthood team, who support our 14 to 25-year-olds, an MDT team with occupational therapist, mental health practitioner, mental health key worker, and an educational mental health practitioner. And some of the things that we've thought about as good practice around scaffolding that access to therapy. So the soft relationship building steps that we can have, but really emphasising conversations with trusted workers alongside clinicians, really joining up the practical support and not just seeing therapy in isolation, but also having various offers. So there's flexible interventions, which are trauma-informed CBT, EMDR as examples of some of the things that we're talking about and looking at. So choice and range of offer, but also to make sure that we've got opportunities that build that continuity, flexibility over time, for people who can dip in and dip out and return, without penalty. And I suppose what ultimately we've landed on is innovation isn't necessarily about doing something spectacular, but really getting the basics done consistently and done well. Thank you.
Thanks, Dionne. That just touched on so many important points there that I'm sure as a panel we will be coming back to, just some really key points. And also, I think, not letting perfectionism be the enemy of progress, of really trying to look at some of the low-hanging fruits that can be changed, and also striving for some of the ones that are harder to change, but where change is still possible. So I'm sure we'll come back to a lot of those points. Dyllan, I might come to you next, if that's okay. And I wondered, from your perspective, Dyllan, what you would like to see done differently to support the mental health of older teens in care and then into the care leaver period. And I've got to say also, because I'm just keeping an eye on the Q&A too, that ReThink followed young people up when they were 18, but there's obviously the care leaver period also doesn't finish at 18. We've done lots of research with older young people going through the care leaver period as well. So we will come back to that as well. But Dyllan, I'd love to hear your views on what we can do better over that period of time.
Yeah, absolutely. And yeah, thank you for the question, Rachel. It's lovely to be here. And yeah, thank you for the introduction. I mean, I just wanted to sort of say, Dionne, like, all of your points were amazing. And I think like something you said at the beginning of what as well as sort of being sort of care experience, it's sort of like quite a close topic to your heart. I mean, like, as someone that is sort of still technically a care leaver for another few months, like, I mean, it's, and sort of also someone that has a lot of intersecting experience with a lot of like the mental health sort of services and systems that, I mean, we've already chatted about and we'll continue to chat about today. I mean, yeah, it's something that's very sort of close and personal to me as well. So yeah, it's lovely to be here. And yeah, in answer to your question, I had like a big old think about this, because we're sort of, for context for everyone, we had like a bit of time to sort of like prepare some answers for this. So like over the weekend, I was sort of just like pulling straws out of my brain, trying to decide like what I wanted to actually say for this, because there's like quite a lot sort of that I think would be really cool to see like done a bit differently in the sort of context of supporting care experience individuals with their mental health. But I've managed to narrow it down to 3 just to sort of save on a bit of time. So I think like one of the sort of key things I want to start off with was about like sort of co-production and sort of improving the co-producing sort of like mental health services, systems of support, whatever context we're talking about for this, that involve care experience individuals. Just because, like, I mean, myself and loads of other sort of individuals believe that co-producing, so like not only sort of designing those sort of services with young people in mind, but also actively giving them a hand on the steering wheel and sort of how those services actually operate and how they support care experience individuals. I mean, I just think it can really significantly boost how that service operates. And while I don't have like any direct knowledge of it sort of happening in an NHS context, I know sort of loads of amazing local authorities out there are sort of already sort of like sort of taking those co-production principles and actively involving sort of care experience individuals in service design, which I just think is absolutely fantastic. So yeah, I think like that is sort of something that I'd sort of love to see sort of like done differently. But in addition to that, I think like it kind of links into what we've been saying, sort of you and Rachel and Lisa were saying in the sort of presentation earlier about sort of creating and promoting sort of activities and opportunities to sort of prevent social isolation for care experience individuals. Just because, I mean, I think most of the people in this call will probably be aware of this already, but I don't think you have to go very far with a Google search to find that social isolation is a huge detrimental factor for sort of mental well-being and mental stability. So I think, yeah, I think it's a fundamental and essential thing for services to create sort of those opportunities of social connection for care experience individuals, so they don't have to sort of like stay in that horrible sort of social isolation bubble, because it isn't fun and it really does impact on a lot of the things that we've sort of already been chatting about. And yeah, so I think just some of the examples that I can already think of off the top of my head. I'm not sure if I'm allowed to sort of say specific local authority examples because I've not actually gotten their permission to say it, but I think just as an example of something that I've come across recently is a local authority sort of like has already taken all of this on board and sort of recently sort of took their care leavers to a sort of pug cafe just in sort of their local authority area, which I don't know how that actually works in a cafe context, because I'd be scared of eating anything in front of like pugs kids running around everywhere. But I mean, it just sounds fantastic, and it really does provide that opportunity for social connection, and it sort of reduces social isolation. But I think more widely than that, I mean, sort of, I don't know if it's too on the nose to say, but I mean, at Become, we have our link up social opportunities, which is literally what I'm talking about. They do like online and in-person sort of like social meetups where they sort of do a number of different activities, and really that really does help sort of with sort of reducing social isolation as well. And there's like loads of other great examples about this. And if anyone had any questions on more examples of things that I've noticed, please do ask it in the Q&A. I do know a lot of random things off the top of my head. But yeah, I think it's just important to say for this is like, while like these aren't a substitution for like those approved sort of like mental health treatments and services that really do help care experience individuals, what they can do is really help support sort of like alongside it, and it can be a really good preventative sort of like form of support. Because I mean, it can do loads of things, like, and it's sort of really dependent and unique to sort of whatever care experience individual that is sort of accessing it. But I think it can sort of potentially provide a distraction point or a point of escape for some care experience individuals. For others, it might just be a really fun and accessible way of getting that social connection opportunity with a group of potentially sort of like-minded individuals. And yeah, I just think it's sort of a fantastic thing that a lot of mental health services or any service should sort of look at sort of increasing and sort of promoting to their care experience individuals. And lastly, just because I think it kind of naturally brings my 2 points together that I've been chatting about into sort of 1 point, which is peer support. So what I mean by this in this context is sort of, yeah, like care experience individuals supporting other care experience individuals, and like sort of specifically with the context of mental health. Like I sort of heard of so many examples from local authorities and also the NHS as well, sort of with differing sort of like groups of people sort of, yeah, having care experience individuals or sort of people that sort of actually experiencing or previously experienced the things that sort of the group are sort of actually going through at the moment. I just think it's a vital, amazing thing that I think can really benefit a lot of individuals. I mean, I sort of personally have experienced like peer support groups, and I think it's really done wonders for my mental health as well. And I think for loads of other examples and contexts where sort of peer support programs are taking place, I just think is absolutely fantastic. Just because it kind of provides an opportunity outside of that sort of like direct support network, just to actually be able to chat to someone else that might be able to potentially get a bit more what sort of you're going through. And I just think, yeah, that's absolutely fantastic. So yeah, so I think that's the end of my waffle. So I hope those points made sense. But if anyone has any questions, very happy to chat about them. So I'll hand back to you, Rachel.
Dyllan. Not a waffle at all. Some excellent points, and I think links really nicely to what Dionne says, and a lot of it does remind me of making sure as the professionals around our young people that we don't forget kind of child wellbeing 101, connection, peer support, a sense of belonging, a sense that people care about you, that these are so fundamental, and sometimes in the complexity of it all we forget some of those things that are just so fundamental to well-being that we've known about for such a long time. I didn't know what Dyllan was going to say there, so this hasn't been set up, I promise, but I did also just want to flag the UK Trauma Council, where I'm also based, a few months ago launched the Department for Education funded Connect Community of Practice, which is a free community of practice bringing together professionals supporting young people who might be living in complicated situations. And the reason I flag it is because next month there's a free lunch and learn focused on co-developing services with care experienced young people or young people with lived experience. So for those interested in co-developing services, as Dyllan said, there's some really brilliant examples at the moment in the NHS as well as in local authorities. If you go to the UK Trauma Council website under resources, you can find the community of practice. So I'm now going to hand over to Katy. And Katy, I'd really love to hear, I'm sure you've got reflections on what's already been said as well, but as someone leading training at Become, it'd be great to hear your reflections on the ReThink findings and also what you think it means for the training and support of professionals around young people.
Yeah, no, thank you so much, and thank you for having me here today. It's been brilliant hearing from Dionne and Dyllan as well. So thanks for all your input. I mean, I think this just really highlights, doesn't it, how vital training is for sort of key professionals that are working alongside care experienced young people. That includes people like personal advisors in leaving care services, social workers, foster carers, supported accommodation providers, you know, staff in education settings. There's so many people that are in the sphere of care experienced young people. And of course, it's, you know, hearing what we've heard today, I feel that training should include things around how to support with mental health and well-being. But also, I think that real focus on how best to support aspects of the transition out of care is just so vital. And, you know, it really struck me when that young person thought that they felt that they were being thrown out the door. And that was the quote that you sort of highlighted there. And, you know, we don't want anybody to feel that they've been thrown out the door of anywhere. And so, you know, that consistency in communication and accurate information being passed between professionals that you mentioned, you know, it's really vital, isn't it? If young people have been getting those mixed messages, is that because the professionals don't have a clear understanding about things like rights and entitlements? And that is quite a complex area. And so helping through training, helping professionals and carers to understand so that they're not passing on the wrong information to young people, and then it all becomes a big jumble. I think, you know, those sorts of things are really important. Obviously, you know, the things that we heard around young people sort of reliving some of their memories and those sorts of things, you know, if people need to have that understanding of, you know, the impact of trauma on development, but also as young people, and how they can, you know, their coping mechanisms, and as they sort of move forward, and the types of intrusive thoughts and things that they might have. And they need to be able to understand what a trauma informed approach to their work might look like. And they might also need to have some strategies up their sleeves that can help with young people supporting and understanding their emotions and regulating their emotions. So, you know, there's some really positive work out there, things like emotional literacy and emotional coaching and those sorts of things that can help with, you know, those areas. I think, you know, knowing how to recognize the signs and being able to, you know those symptoms and really know at the points at which young people really might need some referrals into other services is really going to be vital. Obviously, there does need to be an enhanced level of support and that's available to young people, and that is a bit of a challenge, as we hear about a lot. But you know, we know that there can be long waiting lists and those sorts of things. But I think that there's a lot of things that professionals can be doing and care, you know, can be doing that proactively promote the sort of key areas that are known to support positive well-being. And I think that's the joining up the dots of things. And so there's lots of different aspects with the pathway plan. And if you look at those pathway plans that are being put in place for young people as they move out of transitions, a lot of the areas that you've been talking about are covered. And it's about, you know, people really knowing how they can all link together to support that. And so we focus about helping people to understand how to develop holistic and personalized pathway plans that fully include the young people in there, and give them that agency in making those plans themselves. And so it's about really finding ways to engage young people in that process and helping them to understand what it is, and not as a professional just seeing that as a statutory tick box exercise. It's about how we can draw those things together, and that takes reflection sometimes, and takes people to stand back and think, hang on, let's look at these areas, let's work through them and try and see how we can do things differently so that happens for the young person and they feel involved and engaged in it. I mean, I think one of the key areas of that plan is around relationships, and we've heard from young people that sometimes that can feel quite overlooked as an area, and we know how important the social networks are, and that can be about navigating relationships with family, with friends, about plugging into other social networks, you know, joining clubs, getting involved in activities, doing voluntary, you know, just building that sort of network of support around you. And again, this is part of the pathway planning area, but I think sometimes it can get a little bit left behind when people are focusing very much on finances and having, you know, somewhere for that young young person to live, and that's not always going to be, they might have somewhere to live, but if they don't have a social network around them, they're not stepping out of the house to engage with other people, that's going to have a negative impact on well-being and mental health. So yeah, so I think lots of things that can sort of be built into training, and we know that there's a huge amount of uncertainty around that transition period, and I think there's often, I think some people think that that the only sort of traumatic things that happens are before a young person enters care, but actually there's trauma that can happen through the system and the way that the things are done within the system. And I think actually helping young, local authorities and the professionals that work in them to sort of think about trying to minimize the level of re-traumatization that's happening for young people as they go through the system can be really important. And I think hearing from care experience young people about their experiences can be so vital. And so when we deliver training, we really, to personal advisors, we really try to bring the voice of young people in. And I know that hearing certain things can really open the eyes of people to things and think, I don't want to do that again. I don't want to work in a way that might cause a young person to think or feel that way about themselves. And so really that helping them look in and look at and reflect on their practice, I think can be really a great way of helping to support positive outcomes as people move forward. So yeah, I think that's probably it from me on that.
Thanks, Katy. And I think what you when we're thinking about the training of the systems around young people, it's so important. And Dionne touched on that as well. With it can't just be left to one person to hold all of this thing without support. If they might need input from whoever the mental health lead is, they might. So really that joined up work that Lisa spoke about, I have like some Lisa knows that I have like a particular hatred of the term resilience, because not that there's anything wrong with the term, but I hate the implication that children should somehow just be resilient. But I think we'd all really love to be moving towards thinking about the resilience of our systems around young people, and the training component, and the clarity of roles and joined up working feels really key to that. In the last 20 minutes, we are going to go into the Q&A, and really thank you so much for everyone for adding so many important questions. We'll get through as many as we can. My panel members, I'm going to have to get rapid fire answers from you for some of these questions, or we won't get through it. And I'm going to try to start with some of the earlier questions and then work our way up. One of the questions in here is around trauma-related distress, and discussing what happened, providing care experience young people with an opportunity to talk through what has happened to them and whether that can help. I think probably as the resident child trauma and mental health person, I can jump in first and say we should never be forcing young people to talk about difficult experiences if they do not want to. That is an absolute non-starter. But it would be a very ideal situation if young people knew that there were safe adults around them that could hold hearing about their experiences. We know a lot of young people tell us they feel like the adults can't hold their experiences. And what does that mean for a young person if the professionals around them can't even bear to hear about what they've been through? So certainly we would really encourage adults to be very explicit with young people that if they want to talk about their experiences, that is a safe space for them to do that. There are formal mechanisms like life story work, which remains chronically under-researched for how we do that well, but there is some great research happening in the UK on that. And of course, again, when we think about Child Development 101, it's important for young people to know their stories and feel like they have a sense of agency in that story and have a sense of understanding. And we know that can be pretty chronically missing for our young people growing up in care. So it's not a black and white answer, but certainly we want young people to have the opportunity to talk through things if they want to, and certainly in trauma therapy that would be quite a core component often. Dyllan, I wondered if you had any views around kind of life story work and that sense of making sense of your own story.
That's a really good question. I'm not sure if I have like a specific answer for that, if that's right. But I mean, I'm just sort of thinking, that'd be sort of a great way for sort of peer support to potentially sort of like help with that potentially, I think, down the line. Because actually like being able to talk about your story with a group of other people that might have sort of experienced similar things might be sort of benefit to that. But yeah, I'm not too sure of a specific answer for that.
But I think the peer support element's really, really important in that. And most of the time, again, not all the time, but most of the time, young people do benefit from that shared experience, knowing they're not alone. Did any other panel member want to chip into either life story work or that sense of Lisa, you've unmuted, and then I'll come to you, Dionne.
Yeah, so just to hop in on that, in terms of, as you've already said, Rachel, there is some really good research happening around life story work. Also, just think it's worth mentioning within that context the work that Family Rights Group are doing with Lifelong Links, which is very much about connecting the relationships that children had with their families before they came into care and then during care. So it helps them to have a better sense as to why they actually came into care in the first place, because again, we know from the wider research that quite often children do not have a full understanding of that, and then that helps to support those relationships.
Yeah, thanks, Lisa. Really important. Dionne.
So just to add on to it, that one of the things that we've been focusing on a lot is how you write and using language that cares. And I've seen records over the years that haven't been done particularly well, and I've seen the impact of the records that have been done well. We have a life story practitioner in Haringey who does the most beautiful work, so that people have their story that they have worked very collaboratively to develop, and it's hugely impactful. And you know that when they grow and go back over that, it will have a lot of meaning. So taking the time and the care over that is something we really should focus on.
Absolutely. Yeah. And we cannot underestimate the importance of appropriate record keeping and appropriate information storage. But actually, again, not pre-planned, but the Connect community of practice is having a free lunch and learn on record keeping. And there's some brilliant, the person that springs to mind, Rebecca Pierre, has done some really important writing on record keeping in children's social care. Katy, did you want to come in on that?
Yeah, I just echo as well. We had one of our young trainers whose care experience share with us redacted records that arrived on their mat, which, you know, which had so many things pulled out of that people couldn't see, but also the sentences that were visible were not written in a particularly child or young person friendly way or a sensitive way to young people. So I sort of do echo those thoughts, and it is such a vital part of that and helping people to think about the way in which they write. I just want to say in relation to the life story work that I think that sometimes life story work can be done quite early in a young person's care journey, and then it's sort of almost ticked off the list of that it's been done. And actually, I think as young people grow and their brains change and they want to explore different things, and actually going back to the way that was written when they were in primary school or something like that isn't, you know, that it might need to be something that's revisited over time as young people question in different ways. And so I think that there's that sense of at what point does the life story work happen, and can it be revisited again as people grow and change, and adolescent brains change and want to ask different types of questions and know different types of things as well. So it's just
really important point, not to think of any of this as a one-stop shop, that it needs to be revisited. That would be totally developmentally appropriate, wouldn't it? I feel the same way about mental health support, that having to revisit mental health support doesn't mean earlier support failed. That might be a completely normal part of a young person's trajectory. So really important points. I want to dive in next about access to CAMS. It's been asked a few times. I know we've all met before and have lots of overlap in lots of different parts of our work and lives. And one thing I think it's safe to say we all agree on is that when we're thinking about supported periods over care leaving, you shouldn't be starting at 17, that we need to be as early as possible looking at providing the right support that young people need at the right time for them, that matches their needs as an individual. Care experience young people don't all have the same needs, so is really individualized, really needs matched as early as possible in their care journey. And so that does raise CAMS and CAMS's role. And we know people sometimes feel frustrated that young people can't access CAMS, or their experience might be that young people in care don't want to access CAMS. I wondered if anyone on the panel wanted to go first at how we could maybe build some bridges or support young people with mental health that may or may not be in CAMS. Dionne,
So I've cut Dyllan over to you.
Dyllan, you come in, then I'll go back to
Are you
Dionne.
sure? Is that all right? Okay,
Yeah.
cool. All right, thank you. But yeah, I was just sort of thinking, like within the context of CAMS, it sort of just linked into a comment I just saw in the Q&A about like language being sort of so important. And I think, yeah, it sort of links into, so I think something from my own experiences, like I think one of the first times I went into sort of CAMS as a care experience individual, I think it was called LAC CAMS at the time, which I think they've changed it now because it's quite a horrible sounding term. But I think like I don't know if that's a consistent approach like across like local authorities and sort of CAM services. So like actually like thinking about the name of the service that care experience individuals will be going into. And I think like sort of like Katy was saying, that sort of training for professionals and staff in how to sort of being care aware and actually understanding a lot of those sort of care experience terms. So care experience individuals might actually feel it's a bit easier to kind of share bits about their story because professionals will be aware what those terms mean. Because I think I've sort of experienced it where sort of psychologists haven't actually understood what like a placement means. Like I think I had to define what a foster carer was, sort of like things like that. And I think that can be really quite hard with sort of like building that relationship in the sessions potentially as well. So yeah, like definitely thinking about the language and being more care aware with mental health services for sure.
Definitely, Dyllan. And we've come a long way with that, but there still feels like there's a long way to go to make sure it's consistent and not a postcode lottery of even around language. So that's really important. Dionne, did you want to come in?
So I went to a spotlight on best practice a couple of years ago, and one of the things it was partly in response to how services were looking at the impact of the murder of George Floyd and the development of cultural competence in service delivery. And particularly one of the areas that stood out for me as something that was around best practice was how they approached the therapeutic offer, and with that real emphasis around cultural competence for who they employed, how they employed, but also listening to the young people and their experience of that service that was offered. Now, if you think some of the questions are about unaccompanied asylum seekers and thinking about trauma that is even broader that people are responding to, that culturally informed approach as well, being something that we could give thought to, and it means it has great impact, I think, from the feedback I saw from young people. So I just wanted to add that in.
Really important. And there are some questions about unaccompanied asylum seeking children. We certainly one thing to say about the access to services for that group, which I saw there was a question in, is that it is like with everything else, it's a total postcode lottery. Some areas do have specialist mental health provision for unaccompanied asylum seeking children. Some areas don't. They obviously are another very important group that are struggling with their mental health within a socio-political context, if I'm allowed to say that is probably not good for their mental health. So it's another area where we really need to think the layers. It's not just about the young person. It's about the training and how we hold and support the system around them, through to our statutory guidance and policies and how that can interface with their experiences. The same is true for other young people in care and care leavers, and it is also true for our unaccompanied asylum seeking children. But the provision, just to the question in the chat, differs across the country. But certainly very high rates of trauma-related distress in that population as well. So the only other thing I wanted to add about CAMS is I'd really encourage people to kind of try as hard as they can to move away from a narrative of CAMS not taking our kids, or our kids don't ever want to go to CAMS. And I know why that narrative's developed. I know everyone is under huge amounts of pressure in their workplaces. We would really encourage service leadership across CAMS, ICBs and local authorities to come together, sit around a table, Lisa and I, with colleagues, produced a recommendations report that we'll share after the chat. And one of the key recommendations was making sure our local authority and CAMS leaderships meet so everyone understands what provision is available in the area. And we always want to offer young people mental health support if we think that's indicated, and make sure they can make informed decisions about whether or not that's right for them. But we do know it can feel tricky out there. And again, it is another area that is a pretty major postcode lottery. Some of you will be aware there's some national pilots that have been announced to try to look at new ways of addressing mental health. And we'll await to see how they play out as well. Lisa, I wanted to come to you about semi-independent, and within that also residential provision for our 16 and 17-year-olds. Certainly we had a lot of young people on ReThink in those kinds of provision. How do we make sense of that provision? How do we hold that nuance? And any reflections on young people's experiences in ReThink in those kinds of provisions?
Yeah, absolutely, and it's a really pertinent issue that I saw it in the chat as well, particularly for 16 and 17-year-olds, and it's a debate that is, I think, very prevalent at the moment, where we have 16 and 17-year-olds placed in supported accommodation, but a lot of questions being raised as to actually whether that does provide support or not, or whether it's more so about a housing rather than a placement. I think in terms of what we do know from ReThink and the wider research is that we are finding an increasing number of 16 and 17-year-olds placed in supported accommodation where the support is substandard. The other thing I just want to raise, without sort of going off on a rant on this, is that quite often, and Rachel, you raised this in the presentation about the needs of the young people who are living in residential placements. And I think, again, just to highlight here and with this group, is that quite often, again, we get focused on young people living in residential care and it being a very negative experience and foster care being good. And I just want to highlight again from what the research is telling us is that residential care is not a singular placement. There is huge variability in residential care, and for some young people it can be a positive experience and for others it's not, and that is also the case for supported accommodation. What we need to focus on, rather than the placement type, is thinking about what is the purpose of this placement and how do we ensure that wherever a young person is living, that they are experiencing a quality placement. I think at the moment in the system, we get so fixated on, is this a residential home or is this a foster care placement, rather than really thinking about purpose and quality.
Yeah, thanks, Lisa. And actually, one of the books we shared at the end, the Fostering Guide, led by Kim Emaniki and her colleagues, they actually speak to that in there, that actually stop being so black and white about what placements are and think about what young people might need from a placement. Did any of the other panel want to come into any views around how we can support young people in their placements? It's fine if not. We've got many other questions to get through in about 8 minutes. But any other views? Okay.
I mean, I think somebody asked in one of the other questions around, do we provide training for foster carers and like supported accommodation workers? And yes, we do. But I think there are other organisations out there as well. We're not the only ones. But I think it's prioritising that, isn't it? It's about giving good time to the members of staff that coming into these situations. And I think that since there's more regulation of some settings and those sorts of things, I think we're seeing a growing sort of desire to sort of upskill staff in these areas. But I think it is so vital, isn't it? Because if the people around the young people, they can be personable and friendly and good, but if they don't have the right information or the right skills to be able to do their job well, then I think that's just vital, isn't it, really? So that it is just about anybody who is in charge of these sorts of organisations prioritising professional development for the people that are working in their setting, to be able to provide that very sort of young person centred, sensitive, but trauma informed sort of practice and way of working with young people. I think that's just so key.
Yeah, absolutely, so important. Thank you so much. Dionne.
So, the couple of things really quickly. So one is, as systems leaders, how do we make sure that we absolutely draw on all the locally available resources and make sure that together they are combined to offer the best packages of support that will meet a range of needs? And again, back to that one size, you can't have a one size fits all approach. And the other is just touching on your point, Katy, and I think having a care leaving service, and I've got brilliant PAs and so on, but we've got people who are holding really high levels of risk at times. And we really do need to make sure that they are well supported. So I think it's been said, I won't say more than that. But I think the combination of knowing you're not doing it in isolation, you're doing it as part of a system, and you will need, so if we don't talk so much about young people's resilience, but that resilience in the system, how do we make sure that that around young people really combines for best effect?
Yeah, and just, you know, supervision and reflective spaces for staff is so important. And when budgets are tight and resources are tight and everyone is feeling very stressed, it's often the first thing to go. And that is a real shame, because we know it is so fundamental in social care, in mental health settings, in the justice setting, in the education setting. Doesn't matter what setting you're in, making sure you've got strong supervision and reflection spaces. It's not, as with trauma-informed training, it's not, I've been to this training and got a certificate, so now I'm done. It's ongoing, it's reflection, it's support, it's supervision, because people are holding complex workloads and we need to recognise that. So we've only got 5 minutes and I want to come to the panel. There's lots of questions we haven't got to, but I hope we've got to some of the main ones. Yes, I'm sure we'd all love to see funding that allows service access up to 25. There's work happening in that space. We just have to be mindful that it's funded properly. Otherwise, we just shift budgets to other areas. But certainly for mental health services, we would love to see that. Being mindful that we don't create a cliff edge at 25, that we're really thoughtful about how we manage that. In the recommendations report that we'll share afterwards, we speak to that a little bit. I think a lot of points really well made in the chat, and a lot of call for resources, and we'll share as many as we can after this. So I wanted to come to each of the panel members, and I want to end on a message of hope, because it does feel heavy sometimes in this space, because the needs are great, and we all want to be doing better and thinking more innovatively, and it can feel like quite a mountain we're climbing here. But I do also really, really strongly think there's a lot of reason for hope, and that we can do things differently and better for our care leavers. So I wanted to go around the panel and just get very, very brief reflections on what you feel hopeful about as we move forward with supporting our teens in care and care leavers. Lisa, as my co-PI, I might be mean and put you on the spot first, and then I'll go around the panel.
That's fine. It means I get to say something first. So very quickly, because we are short on time, is what we have learned through ReThink and from colleagues today and our webinar in February is that flexibility is absolutely key. So yes, resources are limited, but there are ways in which we can be flexible. And we've got some really good examples from some local authorities being flexible to support care experienced young people.
Thanks, Lisa. Dyllan.
Okay, yeah, thank you. And I mean, what's given me hope is just like the sort of ReThink project in of itself, really, like, and the webinar that we're in at the moment, just because I think it is like natural, like sometimes I think for like anyone, but sort of for care experience individuals, like especially like to feel a bit like apathetic that things will like change, and like sort of having that hope for the future that things will get better, like especially in the context of mental health. But I think like what this report has done, it's kind of like sort of heard that line that I'm sure we've all heard before, of like we need to do something about mental health, and double down and actually given actionable recommendations, and actually sort of saying how we're actually going to sort of do this and how like sort of services could be improved. So I think that's absolutely fantastic, and I'm very hopeful, full of hope for sort of the impact I have no doubt it will continue to have. So yeah, it's been great. Thank you.
Thanks, Dyllan. Katy.
Yeah, I feel hopeful because I am seeing this sort of growing desire nationally for corporate parenting to be less corporate and more relational. And I feel that that real sense of we've got to put the young people at the centre of everything and certainly with the professionals that we work with that come on our trainings and those sorts of things, we see that a real genuine desire to want to do the best that they can for the young people that they're supporting. So that brings me a lot of hope. And then hearing, like we hear from lots of local authorities, but Dyllan's mentioned some, Dionne's mentioned some about some specialised mental health support and wellbeing support being put in places by leaving care services or children in care services within local authorities that is specific to that group, but also that this sort of social spaces and things like that are opening up and sort of that hub and that focus again on that sort of relationship, and I think that's really hopeful and that can only be for the good. So thank you.
Thanks, Katy and Dionne.
Well, I'm incredibly hopeful because the system is a lot better now than when I left care. Being here today is just an example of that. So I would say to people, never give up hope. And when young people are finding it tough, they do come through. Things can get worse, but they really can get better. So we keep doing this, we keep talking, we keep building, and it will continue to improve services, I am sure. It's been great. Thank you for asking me today.
Oh, thank you. Thank you so much. I can only echo what the panel members have said. The statistics are heavy and we can't shy away from those statistics of the mental health needs of our young people in care and care leavers, but there is a huge amount of hope out there and there's so much amazing innovation happening, even in the current context of challenges with funding and capacity. There's some really innovative work happening, and that I think is a reason for us all to feel hopeful that we could see that being rolled out more widely so any young person in care and care leaver can access the support they need when they need it. So thank you so much for everyone for joining us for this webinar. Again, apologies for the tech issues at the beginning, but thank you as always for navigating that and joining us and for all of the questions. We will circulate the recording. We will circulate as many resources as we can. And this isn't the end of the conversation. There's a lot coming out of ReThink over the next few months and longer. And there's a lot of innovative work happening at Become, at other organisations, within local authorities, within the NHS. So a lot of hopeful and really great work happening. And we look forward to seeing how that unfolds. So thank you for joining us today. All the best with the rest of your day. And we hope we'll see you at a future webinar.
Bye all. Thank you.
Bye-bye.
Thank you. Bye, everyone.